Some clients, like Mrs. I Want a Second Opinion, are just unforgettable. She had been to one of my colleagues for her pet's yearly vaccinations and was appalled when the veterinarian mentioned her dog had severe dental disease. She just couldn't understand how the teeth got to be in such horrible condition. She only fed her pet the best dry dog food, had the last dental cleaning 3 years ago, and no, she never brushed her dog's teeth at home. Why should she? She had owned dogs for years and had never done it before. Besides, wolves never brush their teeth, and the dog was 12 years old, way too old for anesthesia. I knew she was going to be a challenge, and I love a challenge. First, I hit her with the facts. 85% of all pets over 3 years of age have some degree of dental disease. Any age, any breed of pet can be affected with dental disease, but often it's the small dogs and pets with flat faces, like pugs and Persian cats, that are more prone because of their dental alignment. I agreed with Mrs. Second Opinion that in the past, pets did not have their teeth routinely cleaned. Veterinary dentistry has advanced dramatically. It's now possible for a pet to receive a dental cleansing comparable to what any person would experience. Procedures such as dental x-rays, root canals, braces, even dental implants for lost teeth are available for dogs and cats. On the subject of wild relatives, they don't dine on processed foods. They often consume the entire prey and gnaw on raw bones. I told her I don't recommend bones for my patients. They can splinter and act like shards of glass in their intestinal tract. I then informed her that dental disease is more than just a cosmetic issue. An unhealthy mouth allows bacteria access to the body's blood supply. This shower of bacteria can irreversibly damage the liver, the kidneys, the joint, and heart muscle. The damage will not be immediate, but insidious in nature. Despite my facts and figures, Mrs. Pet Owner was still in denial. How could the teeth be that bad? The pet was still eating, and its breath wasn't that horrible. I lifted up the dog's lips and showed her all of its teeth, not just the ones in front. There were areas of severe gum loss with root exposure. Many of the teeth were finger loose, and the clincher was the yelp of pain her little dog made when I applied pressure to the red and swollen gums. She was now convinced. At the 1-week follow-up visit, I was presented with a bouquet of flowers from a very happy pet owner. The dog was feeling like a puppy again, and her husband had even stopped calling the dog buzzard breath. She promised to brush his teeth daily, bring him in twice a year for complete wellness examinations, and get his teeth professionally cleaned when needed. Wondering if your pet could benefit from some dental care? Just ask your veterinarian.